Hello, everyone. In response to a message that I'm seeing in the Bell's Palsy solution group that I run, lots of things about Botox and the management of facial palsy with Botox. So first of all, facial palsy is a chronic condition. Anybody needs to understand this because it's just like diabetes, it's just like high blood pressure. It is something that is here if you have synkinesis. Synkinesis does not go away. Synkinesis can be managed to extremely good degrees with combination of facial therapy and Botox, and sometimes with helps of some very specific facial surgical procedure. But when you have synkinesis, the way your nerve healed, that's not going to change. So that's very important to understand this. Just doing Botox a couple times is not going to cure your synkinesis. Again, you cannot cure synkinesis. You can only do what is your only option, which is either conservative management with facial therapy and Botox, and or in some other cases with added surgical procedure. So again, Botox takes, I always recommend my patient to have at least rounds of Botox for a year, which is generally 4 rounds, prior to make decision on if they want to go with a surgical procedure. And of course that also kind of varies, but I think for most people, and depending on the severity, that all depends on the severity of the synkinesis and how it affects your function. But it takes a few rounds to figure out the proper location and amount of Botox necessary to manage your very specific and unique presentation of facial palsy. So this is not something you just try once and, oh my gosh, I'm gonna be just better and that's gonna be it. That is not the concept. So I thought I would reiterate that and make that clear, because I don't think it is for most people, since no one has really talked to you about this. So here we go. Anyway, have a good day.